Biotin can interfere with lab tests, but it's more than just an inconvenience. It can also pose a real risk to patients. Do you know about the risk? Let's take a moment to understand it. Biotin is an essential B vitamin found in a wide range of foods. Genuine deficiency is rare, but some people with metabolic disorders are prescribed biotin. Others take it as a well-known beauty supplement that claims to improve their hair, skin, and nails. It's common knowledge that the number of people taking biotin supplements, sometimes at very high doses, is growing. What's not so well known is that sometimes biotin in your system can interfere with blood tests that use the free capture Streptavidin biotin method. Getting the wrong result because of this can have serious consequences, and in November 2017, the US FDA communicated a safety alert warning how test results can be adversely affected. The public at large has no idea that it's an issue. But the real problem is that clinicians don't know who's taking biotin and who isn't, so they may not be able to rely on the test result. The same is true for the labs testing the blood. They have no idea which samples contain biotin and may not know which test results are affected, or even that some brands of assays can avoid the issue and give accurate results whatever the level of biotin in a sample. In theory, if a patient is aware that they are taking biotin, their doctor could delay a test, send them home, and reschedule another visit for a date 48 hours or more after they've stopped taking the supplement. But this means extra appointments and wasted time that could be spent with other patients, plus a delay in testing and diagnosis. More importantly, the scientific data does not clearly show how long someone needs to stop taking biotin to prevent it from affecting the test results, so there's still a risk of misdiagnosis, incorrect treatment, and even death. For acutely ill patients coming into the emergency department, testing can't be delayed, but there's no way of knowing if and when they've taken biotin. The reason behind all this is that some laboratory test manufacturers rely on biotin as a key component in both sandwich and competitive immunoassays that use the free capture Streptavidin biotin method. This makes their tests susceptible to interference from free biotin in patient samples and so vulnerable to inaccurate results. Let's look at how this can happen in a typical assay. In a sandwich immunoassay, the signal-labeled antibodies and biotinylated antibodies form a sandwich around the analyte. Streptavidin-coated microparticles are added to capture the sandwich at the site of the biotin. After a washing step, a signal is generated from the bound labeled antibody. The higher the signal, the higher the concentration of the analyte being tested. Competitive immunoassays work differently. The free analyte in a sample first forms a complex with antibodies, then Streptavidin-coated microparticles and more biotinylated analyte are added. The antibody biotinylated analyte complex is captured by Streptavidin-coated microparticles, and following washing steps, a signal is generated from the bound labeled antibody. This time, a low signal corresponds to a high analyte concentration in the sample. This is because the free analyte in a sample directly competes with the biotinylated analyte that produces a signal. There is an inverse relationship between the signal and the analyte concentration. Now let's look at how excess biotin in a patient sample competes for binding sites in both of these assay formats. In a sandwich assay, free biotin in the sample binds to the Streptavidin-coated microparticle, blocking the binding site and preventing the target biotinylated antibody and analyte sandwich from binding. This reduces the signal as the target sandwich is not bound, so can't be detected. In a competitive assay, free biotin interferes with the binding of the antibody and biotinylated analyte complex by blocking binding sites on the Streptavidin-coated microparticle, again reducing the signal, but this time giving a falsely high result.